Hi, beautiful people. So, this morning I just want to address a few questions I've gotten the last couple of months regarding IVF. There are so many assisted reproductive procedures for which IVF is one of them. IVF is in vitro fertilization. So, generally, the process of or the procedure of IVF has to do with, using medication to stimulate the ovaries to produce eggs. A human has eggs, like women produce eggs. Okay, so and the eggs are produced in the ovaries. So IVF is all about using drugs to stimulate the ovaries to produce more eggs, to produce quality eggs. And when these eggs are produced and matured, they are extracted and they are fertilized in the lab using the male sperm. And when this fertilization is done, it is transferred into a glass tube where an embryo is formed, and this embryo is now retransferred into the woman's womb where the baby will develop, and after 9 months we have a healthy baby. But there are myths and misconceptions going around about IVF. Most people say IVF babies are not normal babies. Most people say IVF babies have syndromes. Most people say IVF babies have one or two score happening to them. So I want to quickly talk to us about the few myths and misconceptions that are flying around regarding IVF babies. And being a reproductive health expert, I feel it is my duty to help, bust most of these myths and misconceptions that we have going around. So let's quickly dive into the myths and misconceptions that are surrounding IVF babies, and we can quickly talk about the real facts. One myth is that IVF babies are less intelligent than naturally conceived babies. That is a big fat lie. That is not true. Hell no. IVF babies are as intelligent as naturally conceived babies. In fact, there is no scientific proof whatsoever to say that an IVF baby is not as intelligent as a non-IVF baby. One is that IVF babies have a high risk of autism, that most IVF babies can become autistic later on. But it's not true. There is no scientific evidence, there is no scientific link between an IVF baby and autism. Any child can be autistic, both naturally conceived and, assisted reproductive procedure conceived baby. So that is a very wrong, that's a very wrong information to pass around, that IVF babies are autistic. It is not true. IVF babies are normal, natural. Whatever can happen to a naturally conceived baby can also happen to an IVF baby. So if a naturally conceived baby can be autistic, it's possible that an IVF baby can be autistic. If a naturally conceived baby is normal, it is also, the same thing applies to an IVF baby. We cannot say that something is happening to a child majorly because the child was conceived through IVF. That's not true, please. That misconception is the biggest lie of the century. Another myth I want to talk about is the one that says that IVF conceived babies have a high risk of health and developmental problem. That's not true. That's really not true. Any baby can have health and developmental problem. IVF is not a risk factor to that. Okay? Another myth is that the process of IVF will stimulate your ovaries to an extent where it takes away all the eggs in your ovarian reserve and you end up not having any eggs again after doing an IVF procedure. That is not true. What IVF does actually is to stimulate the ovaries for a single cycle. Every month, a woman is entitled to one cycle of the ovaries releasing eggs. All right? So the IVF process is just stimulating for one single cycle. So if you are doing the procedure in May, you are being stimulated for your May cycle. The medications you're taking does not say that all the rest of your life the IVF drugs are going to keep stimulating the ovaries. No. The ovaries are stimulated for just one single cycle. And when that eggs are retrieved, that is where that cycle ends. In your next month, in your subsequent cycles, you're good to go. Okay? So the process of IVF does not overstimulate the ovary, except in rare cases where there can be ovarian hyperstimulation syndrome, which does not happen all the time. All right? Your ovarian reserve is where it is. IVF is only making use of one cycle of your, ovulation. All right?